Greetings, my fellow YouTube nurses. You guys want to get down to the nitty gritty? You guys want to hear what happened yesterday, my first time precepting? It was off the hook. I'm just excited. I can't fight it. I'm just all over the place. I'm just happy just because you guys were with me from day one. Thank you again, my fellow YouTube nurses, for watching me when I first graduated. Actually, you know what? When I first became a nursing student, from the trials and tribulations, from the whole graduation, from the NCLEX, to getting my first job in the SNF, to getting the job at the hospital, from nights to days, and now precepting. So I want to say thank y'all for everybody just following me, and thank your grandma for being born. Also, I want to tell you guys for everything you guys have been helping me through. I couldn't do this without you guys, just because I have a lot of dedication, motivation, perseverance, and I just got that drive, y'all, just to keep going and striving to the best. That's what you got to do. All right, let's talk about what really happened. So they put me as preceptor, and I actually had my coworker who followed me. She's been doing it for about 8 weeks. We have this program where it's 12 weeks, and you just start precepting and doing your own thing, work your way up from 1 to 2 to 3 to 4 to blah, blah, blah. 5 patients you're able to take care of on your own, right? So anyway, she followed me, and what makes it kind of funny is I was a tele nurse. So by the state of California, you can only take care of 4, just because you have to pay more focus and more attention to these patients, right? So anyway, I get my preceptee. She's a good, very, very good preceptee. And I'm watching her kind of just shadowing, or she shadows me, but I kind of make sure she does the proper medication administration and documentation and charting, right? And so anyway, she came in and takes care of 2 patients. I took care of 1 because I also had 2 nursing students that had one of our patients. And so it was kind of weird, but it was kind of funny. So basically I had to monitor, watch, and make sure the 2 nursing students were doing their job, and my preceptee was doing her job. So preceptee had 2, my nursing students had 1, and I had 1, which is really cool. But don't mistake that, y'all, because as a nurse, if they make a mistake, it's my license, I get in trouble, so I had to make sure they're doing their part. So anyway, we get there, get report from all 4 of our tele patients. We want to make sure, what the rhythm is. Okay, cool, it's normal sinus. The other patient has, CHF. They also have, a history of AFib. They're on tele. They came in for shortness of breath, chest pain. Okay, cool, they're taking nitro. What's their history? What labs? What diagnostics? And you also want to look for what test procedures they have for that day. So you want to get the consent sign. You also want to make sure that the pre-op checklist is done. So you're all over the place. That's just 1 patient, and your other patients could also be there for pneumonia and like I said, chest pain also. And you want to rule it out by troponins, checking out for that. You also want to make sure you follow if they have digoxin, what the PT INR is, and so we get there in the morning, checking labs. So we're looking at potassium levels and we're looking at magnesium levels. We want to make sure all the levels are therapeutic. Now, that said, we started looking at all that, and I told my preceptee, look, we're going to go over all the doctor's orders. I like to review my doctor's orders when I get there. So my preceptee was like, what? I've never done that before. Well, that's why you're following me. We do different things. And so right when we get there, we looked at the doctor's orders, and we reviewed, we looked at the labs, we looked at the diagnostics, and we want to make sure what's going on with this patient. What's the holistic view? I don't know why I'm doing this, but bam! What is the holistic view on our patient? We want to know why they're there, what are we going to do to get him better, and how we're going to get him out of here in a safe, possible way, right? So that's what you have to do as a nurse. It's like a care plan in your head. You just start knowing this, and you start rationalizing what medications are on, why they're taking it, what's the proper, parameters. So a couple patients would have blood pressure meds and pain meds, and some of them needed potassium replacement. So me and my preceptee and my nursing students went all over that. So I was kind of delegating over our patients, and we had to call the doctor a couple times. I witnessed my nursing students call one time. I had, me and my preceptee were going off back and forth to call the doctor, and we just switched off. But we helped each other as a team, which made it awesome. So it was a fun experience. Like I said before, it was my first time doing that, but I went in there like it was just like I've done it before. You can't just go in there scared. Yeah, I said it, scared. You got to be in there doing your thing. So we ended up delegating for a patient. We phoned the doctor, notified him probably about 7, 8 times. One of the doctors got a little irritated, but you got to do your job. And so, we had to call for restraints. One of the patients pulling his Foley, pulling his IV out twice. We started to get a PICC line, and I'm not going to go any further because I don't want to do no HIPAA violation. But also, my other patient, we had to call the doctor for a parameter. The blood pressure was too high, so we had to get a PRN, vasotec, for the blood pressure to, to go down to therapeutic level. So yeah, and I'm educating my students. I'm educating the coworker, my preceptee, going off why is the patient here? What are we gonna do to get him better? And also educated, patho parts. And it was cool actually talking to my students what's the patient here for, and what's that explain to me? And I was kind of educating, so it was cool. It was awesome. The day went by like that. Loved precepting. Any nursing students out there that want to follow me, leave a comment. No, I'm just kidding. Anyway, y'all, that was my first experience. Loved it. And thanks for following me from day one when I first started as a little baby nurse student and working my way up, y'all. I appreciate it. My fellow YouTube nurses, grandmas, siblings, everybody out there, thanks for commenting, subscribing, and also don't forget to follow me on Instagram, Nursemendoza7. Follow me on Twitter, YouTube, Nurse, and yeah, keep dropping the love, y'all. I'm gonna drop another video next time, and let me know what you guys want me to do on my next video. Hit it up, drop a comment. I'll see you guys. I'm out. Peace and salutations.